Congratulations on making it to the final session of the 2019 OHDSI Symposium. So I tend to give the closing session. I convinced Christian to join me for the closing session, and he literally has no idea what's about to happen. Okay? So we've actually got a lot of things that we want to celebrate, so I'd like to do that as part of this, and I've been feverishly trying to get this ready. You remember that George actually started by saying that our theme this year was continuous evaluation, and we want to know how well we're doing on making progress on our journey. And one of the things that we actually did today, which it was posted on the website, but I'm not sure everybody actually knows in this room, that you guys were all part of an experiment today. The experiment was specifically about our journey for evidence dissemination, because all of those contributors who provided posters, they were actually given a choice. They could either choose to design a poster in a traditional format, or they could choose to follow this better poster design that was developed and innovated by Mike Morrison. And so I reached out to actually, Mike, he's a grad student at Michigan State, and I reached out to him and said, hey, we'd like to use the OHDSI community as a learning lab for us to just test your idea that you think is a good idea, so let's just go ahead and test it. And so everybody who actually had a poster was given the same choice, which was given one of these two templates, which would you prefer to use to present your scientific content to the rest of the community? So an interesting breakdown that I can share with you here is now that we have all of the posters, which are now all publicly posted on the OHDSI website for everybody to take a look at, you can actually see that when given the choice, it's actually pretty remarkable as a community that we basically had about a 50-50 split. So a bunch of people were willing to embrace this new idea and try it out. Other people stayed with our traditional format, and it seems like there's a category by poster style interaction going on here, where our data standards people really liked the better poster a little bit more. Our clinical applications folks seem to favor the traditional approach. And I think it's just interesting to think about the fact that for so long as a scientific community, as like all of us, we just do things because it's the way it's always been done. And I think actually OHDSI is a great place for us to actually be challenging the way things have been done, at least experiment with trying new ideas. And so I want to commend all of those poster presenters who decided to experiment and try something new, and for providing us some data on this. But all of you here were also part of a natural experiment, not just participate, but actually get a sense of, as the consumer of evidence, which of these posters made most sense to you? So I'd like to actually invite you to participate in some additional data collection of our natural experiment. If you could go to this website right now, you could do it on your phone. If you want, just go to pollev.com/PatrickRyan800. Don't know why I got 800, but apparently there's 799 other problems, but I'm the next one. So pollev.com/PatrickRyan800. I want you to go to that website because I want to ask you a series of questions here. Whoops, oh, somebody's already on and already answering it. The first question that I want to ask you is, as the consumer of evidence from the Collaborator Showcase, I prefer the better poster format to the traditional poster format. And so your options are strongly agree, somewhat agree, neutral, somewhat disagree, and strongly disagree. So take your time and enter in your information. Here, we're just trying to get a sense of preference. So you had some posters following the traditional scientific paradigm. You had some posters taking a kind of a radical approach here to provide this information. All right. Apparently, you can also just text Patrick Ryan 800 at 222-22333. Put in your letter if you want to. Fascinating. Okay. So when it looks like, at least according to the data that we've got here, that as it just relates purely to preference of the format, seems like there's a lot of people who liked consuming the evidence in the better poster format. Several strongly agreed, some somewhat, and some neutral. We got a few people, it looks like it's going down right now, but it looks like a few people strongly disagreed and wanted to stick with the traditional format. I think this is just interesting to think about, that we've taken for granted the way that we present posters, and maybe if there's just another way to try things, that it's worth the experiment. Okay. Next question. I felt that I could more quickly understand the main idea on the Better Poster posters than the traditional posters. So if you guys could get on there and answer, pollev.com/PatrickRyan800. Feel like I could better, so it's somewhere between strongly agree and strongly disagree. You felt that you could more quickly understand the main idea of the Better Poster posters. You are part of an experiment. Your data is going to be used to present what we've learned from our community in this. So as much data collection as we can get is highly valued and appreciated. All right, so it looks like we're starting to see a pattern that as it relates to feeling that I could more quickly understand the main idea of a poster, it looks like many people strongly agreed or somewhat agreed that the Better Poster style, that they felt that they agreed to that they could more quickly understand the idea. Interesting. Interesting that also doesn't exactly match up to preference, even though understanding a main idea might be something to do with why we would prefer things. All right, I've got one more question if you could humor me. Okay, you could like it or you could quickly understand things, but what I want to know is, I was more likely to stop and talk to the presenters who chose the Better Poster format rather than the traditional poster format. So again, part of our goal as a community is we're trying to engage and collaborate with each other, so just curious whether or not this facilitated or hurt collaboration and engagement during our Collaborator showcase. If you can enter in your answers at pollev.com/PatrickRyan, that'd be good. I'm going to close my Twitter feed and LinkedIn feed, but I want to actually thank and acknowledge and point out that Craig Saxon has been killing it on Twitter for us and posting lots of things, and it's been great to see the rest of the communities also getting on Twitter. You know, when we hired Craig to be our communications director, he was like, you know, you have a Twitter feed, Twitter account that has like 100 followers and you've never tweeted, and the one time you tried it, you screwed up. And so since then, it's actually been great that we've actually been trying to actually communicate the great stuff that we're doing. And as we heard earlier this morning, this idea that sometimes Odyssey is a badly kept secret, that it still seems to be unknown to most people. I'm really excited that we've got Craig on the team to help us share this message on behalf of the community. All right, votes are in, so it's interesting. So I was more likely to stop and talk to presenters who chose the Better Poster format rather than the traditional format. This actually seems that most people are neutral. Maybe there's a slight bias towards somewhat disagreeing. So interesting here, right? We seems like there may be a mixed perception about preference of style. It's kind of a fairly clean linkage of better way to communicate that main idea. But as it relates to engagement at the poster, it seems to be mixed. So thank you for participating in this study. I would encourage many or all of you to consider other ways that we can experiment as a community to continuously evaluate what we're doing, and not just taking the status quo of how we do science for granted, but also trying to push the boundaries of how we can do science more effectively. All right. So with that, I'd like to highlight the Collaborator Showcase Awards that you guys all voted on as a community. The first award is for Best Contribution in Observational Data Standards. And actually, because we realized last year, we'd highlight some awards, but we would always make this tragically silly mistake, which was we would recognize an individual, and all of our work is collaborative effort. So what I'd like to do is, as I announce the best contributions, the teams that participated in this work, I just ask that you all stand to be recognized. So the Community Award for Best Contribution in Observational Data Standards was the poster OMOP CDM on Oncology Module at Work. Could the authors please stand and be recognized? Traditional poster style. Our award for best contribution in methodological research went to the counterfactual Kaigan. Could the team please stand up and be recognized? Where's Amelia? I don't see her. Where did she go? She disappeared. Oh, I can't. Oh, there's Amelia. You're so behind this light. Congratulations. Traditional poster. Best contribution in open source analytics development. The D-Queen team developed a data quality assessment and managing tool. Could you guys please stand and be recognized? Congratulations. This one threw us for a loop because, of course, this was a live demo. So I hope that you all got to check it out and take a look at the tool. For the best contribution in clinical applications, we actually had a tie in the voting. The first one was an algorithm for classification of ovarian cancer histopathology images and prediction of genetic variants. Could this team stand up to be recognized? Traditional poster. And an informatics consultation service enables the use of evidence for observational data for decision-making at the bedside. Could Allison and the Stanford team please stand up to be recognized? Lightning talk and better poster. All right. So thank you guys, and congratulations for all of those that have just received an award. There are certificates printed at the registration desk that we'd ask for you to pick up, and congratulations. Okay. I look at my clock like, how am I doing on time? Like you guys are going to leave. All right. So I'm going to tell you a story. Tell you a story that weaves a bunch of parts of my life together, and Christian's up here for a reason. How many of you guys have seen the play Hamilton? Like 30 of you. Okay. So Hamilton is a play. It premiered in New York in January of 2015, so about 5 years ago. It is a remarkable piece of theater. It is about the $10 founding father of a father without a father. Anyway, I'm not going to do it. But what's remarkable about the story of Hamilton in this play is the way in which they were able to weave a lot of different key themes about tenacity and persistence and success and overcoming adversity in a variety of different ways throughout this story. And some of us in the Odyssey community are a little bit obsessed with Hamilton. George is, and John is, and I am. I've spent many months of my life only listening to this soundtrack in my basement and singing until the point that my wife and au pair have had to knock on the door to tell me to stop. But while many of us have talked about Hamilton, and in fact, Peter even sang some Hamilton at the Odyssey Europe meeting 2 years ago to celebrate this. So it's always been close, but I'm pretty sure pretty much like nobody, even amongst our closer inner circle, knows the song that touches me the most, which is a song called Dear Theodosia. And so if you'll indulge me, I'm going to play this, hopefully. I didn't sing it. All right, so I think that actually that song is impactful and always gets me caught up. But it gets me caught up for a variety of different reasons that I'd like to share with you today. And interestingly, it comes back to the OMOP common data model. So I feel like I'm a bit of a proud papa of the OMOP common data model, and I've got a second father to focus on this. And it's been amazing to watch this grow and to think about where we've gone. For those of you who don't know, the OMOP common data model turned 10 this year. So this is a data standard that it's a data standard that's been around, at least from version 1, for 10 years. And so I thought it would be necessary and important for us to celebrate with some birthday cake. So Elise, could you bring me cake, please? All right, that looks like a good one. All right, that looks like a good one. Yeah, I don't think those napkins are going to be helpful. All right, so here's the thing. We are all here because of this common data model that we are using to advance evidence, and yet it started at its very onset with this schematic. Now, how many of you guys have used this schematic? Liar. Liar. You've seen this schematic. You've seen the schematic, Mark, but you didn't use it. Because actually, when OMOP started over 10 years ago, we got some brilliant scientists in a room together, and together we were trying to think about how we were going to run an experiment to test methods for drug safety surveillance. And we got a lot of people with very diverse perspectives together, and we said, okay, well, it's just necessary, not that we really wanted to do, it's just necessary that we have to create a data model to run an experiment that's going to evaluate drug safety methods. And we got some of the great leaders in the field together to say, like, how are we going to do this? And what we got was Jeff Brown told us that the HMORN data model was the right thing to do. And he gave us all the virtues of the HMORN data network, which is a data model, which is tremendous and is actually proven to be incredibly successful in enabling claims research in a variety of spaces. And so he laid out this beautiful data model for the HMORN research network. But on that same advisory board, Sean Murphy, also a leading scientist, he came to the table and he said, what we've got is the I2B2 common data model. And the I2B2 common data model is a beautiful model, and that it's been tremendously successful in supporting research and electronic health record data. And what we also had in the community was Mark Overhage, who said, I don't really care what you've got as your data model, but what you've got to do is you got to make sure that you have a standardized vocabulary that can hold this stuff together. And so he just said, you just got to have something to stick things together. So the OMOP Common Data Model version 1 had some of the leading scientists in the world, and that data model amounts to taking the HMORN research data network, taking the I2B2 model, and stuffing it together. That is the OMOP Common Data Model version 1. Christian will now eat some of this. Now, here's the thing. Here's the thing. This frosting, though, so this is a mess, right? I mean, this is ridiculous. Look at that common data model. It's so silly. And in fact, we wrote documents. I wrote papers about this, getting everybody on board. And the moment that I showed it to David Madigan looked at it and he said, nobody will ever possibly use this. Because what we said we were going to do is we said we'd take every single piece of data and we would put it in both data models. So instead of having the best of both worlds, we actually had the worst of both worlds. connected together by a standardized vocabulary that we didn't know how to build. That is a disaster, but it's pretty tasty. So I would say, when we started this, the OMOP Common Data Model, while I feel like I'm a proud papa, I would say that I've made a million mistakes. And it started with this model, I would say was an abject failure. We actually didn't ever use this to actually put data in. We developed it, and we quickly realized this was not going to meet the needs of the FDA and the OMOP experiment. We were just going to have to figure out some other approach. So then came OMOP Common Data Model version 2. This was the schematic that we had, and actually this data model was the first one that Christian can truly take credit and blame for. He and I together sat down for, I don't remember how many days that was together, but it was rough, to sit down and actually figure out exactly how we were going to model some basic pieces of information. And there were some basic ideas from the original OMOP Common Data Model we took forward. The idea that a standardized vocabulary was the only way we were going to support claims and EHR data from inside the US and outside of the US was there at that first time. And we focused on only the data needed to support safety surveillance, because that was the remit of the original OMOP experiment. So I think it's worth us celebrating the OMOP Common Data Model version 2, because this was the data model where we were trying to say that I'll make the world safe and sound for you. So Elise, can we have another cake? All right, this is going to be dangerous. Yeah, I got it. Oh my God. So that, don't want to drop it. That is the OMOP Common Data Model version 2 on a cake. Lamest cake ever, but we've got it. Now, and I'm going to just put my arm in it just to be really nice. Well, where did Elise? Can I have the cutting? Oh, thank you. All right. So this cake this is a good old standard chocolate cake. Kind of boring, probably pretty good, fit for purpose, one goal only, to support drug safety surveillance. It's got strawberry filling too. Christian's going to eat that. Okay, so we developed the CDM version 2, and it actually is the model that supported all of the research that came out of the OMOP project. So every single paper used this data model, and actually, as the community evolved, we found people liked this model for totally different purposes other than drug safety surveillance. And Christian and I wrote the document for this, and we shared it and made it publicly available, not with any expectation that other people were going to use it for other purposes, but simply because we wanted to be transparent in sharing what we were doing. So let's celebrate OMOP CDM version 3. Could we bring another cake, please? This is OMOP CDM version 3. You can see it's a pretty lame cake because it never got baked. What happened was we had a lot of people in the community said, you know what would be really cool is if we could just adapt this OMOP Common Data Model a little bit to support other efforts like comparative effectiveness research. And so Christian and I locked ourselves, I think it was in my basement for that second time, and we tried to write the document that we thought was going to be the best for supporting drug safety and comparative effectiveness research. And the moment we produced that document and shared it with the public, everybody hated it. Edits and edits and edits and ambiguity and people just complaining about it, to the point that we never actually wrote a single line of code. We just pretended like OMOP CDM version 3 never happened. But from those learnings and from the feedback that we got from the community, we evolved to develop the OMOP Common Data Model version 4. And this data model that was produced actually did support going beyond the use case of drug safety surveillance, because we had collaboration between folks that were thinking about wanting to answer clinical comparative effectiveness research. And this is actually what spawned several activities going on in the PCORI effort to support efforts as well. And what we realized was that we could have one data model to support two different use cases in the community. And not only was that an okay thing, that was actually something that we should start to support and encourage. Because if we could have one community sharing the needs of what we're doing, we could be a heck of a lot greater as a community than if we were just to basically have one group doing drug safety surveillance and another group having a different model to solve the comparative effectiveness research question. So I think it's worth us celebrating the OMOP Common Data Model version 4. Elise, could I have another cake, please? All right. Yeah, I got it. Ugh. So there is the OMOP Common Data Model version 4 cake, the second lamest cake to ever be produced by Wegmans. Okay. But the difference of this CDM version 4 cake is that now we still had our beautifully flavored chocolate cake, because we could still support safety surveillance, but now we added vanilla cake, because now we could have one cake and coexist with two different use cases, two different supports to make this happen. So Christian will now eat some cake. So we developed the OMOP Common Data Model version 4. That was actually released while it was still OMOP. And it was an interesting, odd thing we were doing, right? Because we were a public-private partnership supporting the FDA to work on drug safety surveillance. But lots of people were coming to us wanting to use this data model for a totally different purpose. And we were trying to help them just because we thought that's just the right thing to do for science, even though it's not necessarily on the remit for the drug safety surveillance. But an important milestone that took place, and I guess this was released in October of 2014, I remember when Martijn actually made the first GitHub submit of the OMOP Common Data Model version 5, which was the day of the first OHDSI face-to-face meeting held in George's new facility at Columbia University. And this was a tremendous milestone, because now we had a data model that was trying a data model where we were specifically trying to figure out how to support a community. Our goal wasn't just drug safety surveillance. Our goal was actually just thinking about just how do we create data standards that everybody could use and make use of. And we evolved to support a broader set of use cases. We evolved to support a broader set of data elements. And importantly, this was the first time we got serious about standardized vocabularies. This is the first data model where we actually said that the vocabulary is going to drive where the data goes. And that was actually kind of a landmark moment, because it was the first time that we got serious about saying that we need to standardize data as a community, not just have a data model that has the same tables and fields, but actually have the same semantic understanding everywhere in the data. So I think it's worthwhile for us to celebrate the OMOP Common Data Model version 5. Elise, could I have another cake? I didn't know it was a trick question. What we realized actually when we were doing the OMOP Common Data Model version 5 was that this isn't just about a data standard. This is not just a cake. This is actually the marriage of important things that need to come together. And this was the start of OHDSI, was the OMOP CDM version 5. And so what was that marriage? Well, that marriage was the recognition that if I give you a standardized data model, you got nothing. What you need is a standardized data model, you need standardized analytics, and you need a community willing to actually collaborate together. And it's only through us being an open science community with open source software and open community data standards that we're going to actually be able to accomplish great things. And so the CDM versions 5 was particularly important to provide that marriage to us. Oh, this is going to be a disaster. All right. We got some chocolate. We've got some vanilla lemon custard. Oh, my sign fell down. And we've got mixed fruit all together. A happy marriage of standards, community, tools, and data standards. And Christian will eat some cake. All right. So, I got to give Christian a moment to eat all that cake. So I'm going to take a little bit of a departure from this story, because when we created the OMOP Common Data Model version 5 and we created OHDSI as a community, I actually had no idea what was actually in store for me as individually until 1 year after the OMOP Common Data Model version 5 came out with the birth of my daughter. This is a picture of Catherine. Catherine was born in December of 2015. She was born premature and had various complications that gave her a rough journey into this life. And so when she was born, she was immediately rushed into the NICU, where she spent the first month of her life. And during that time, we found out that she had ventricular septal defects. And the medical opinion of the neonatal cardiologist at the hospital that we had at that moment in time said we had two options. Catherine could have surgery right away, or we could see if she could make it a week and then have surgery in a week later. And those were the two options that we were offered for her. But because of the community that we had formed, I actually knew people that knew things and knew people that I could probably get second opinions of. And actually, I think I just saw Charlie back there. I called Charlie and said, hey, Charlie, you're part of our community and we're collaborating on things, but I got just a personal favor to ask. Can you help me find a cardiologist at CHOP that can give me a second opinion? And Charlie was gracious enough to find me somebody wonderful at CHOP who gave me a second opinion, and her opinion was that Catherine shouldn't have surgery at all. Now, how is it the case that in 2019 we could have a case in front of us with all of this electronic record data, and we could have one doctor that says, I got two options, surgery today or surgery next week, and I can have another doctor who says, third option, no surgery at all? That's a disjoint set of clinical opinions. And the challenge with that disjoint set of clinical opinions is neither of those clinicians actually had any hard data to support those assertions. Rather, they were going based on their opinions, and both of them were remarkable clinicians trying to do the best for me and for Catherine. And yet I was extremely frustrated by the reality that we were sitting here and dealing with these opinions when I'm sitting here holding my baby daughter, wondering if she's going to make it through the week. I do not find that to be acceptable. Now, when we were continuing to try to get Catherine out of the NICU, this was a trying time, sitting in the hospital and trying to figure out what the right thing to do. And going back to Dear Theodosia, the quote that said there is and I thought I was so smart. You know, I'm sitting here and I'm a member of this community, and we're talking in abstract terms about how we're going to help diseases and help the medical condition, and yet here I am sitting in a hospital with my baby daughter in the NICU, and I have no idea what to do. I'm completely helpless. And I'm getting extremely frustrated because the only thing that can pacify me is evidence so that I feel good about making good decisions for my daughter, and I felt completely paralyzed to the fact that I didn't have that evidence at my disposal, and I didn't know whether I was doing the right things for her when I was faced with these decisions, and had a wonderful clinical team supporting her. But I can say that for all the work that we do in talking about observational data, answering questions, the reality was I felt completely useless, and I had to make lots of medical decisions during this month. In fact, we were discharged from the hospital, and I took the recommendation of our colleague at CHOP to discharge her and just to watch and wait. But during that time, I had to administer a lot of medications to Catherine while her VSDs were resolving themselves. And for all of these products, I was asking a simple question, which was, What's the safety profile of these medicines for a premature baby who's home in his mind? So it's not just an abstract question, but it's a question that matters to me right now. And what dawned on me about this is that, I've been a passionate advocate for everything that we're doing for quite some time. But when it hit me directly that I'm sitting there and don't have the answers to these safety questions, the very questions that I'd been spending the last 5 years of my career saying that we should build a system to be able to do this, irony's only the beginning of the start of it. And that's when I really made a personal commitment at that point in time that it is not about making the world safe and sound in some abstract sense, that this is an obligation we have not just because we're researchers and we think it's a good idea, because patients are waiting for this information and deserve to have this information. But I was actually in luck. I was sitting in the NICU, and I had access to patient-level data in the OMOP Common Data Model version 5. So I did what every concerned parent does. I wrote code against a data set to actually answer questions about what is the side effects of these medicines. And in fact, for every single one of these treatments that I had to administer to Catherine, I produced a safety profile for myself so I could understand all of the uncertainties about these products and what happens when you give them to premature children. And it was on the basis of this that I felt actually confident, not that Catherine was going to be well, but that I was making informed decisions. And at least for me, having evidence gave me tremendous comfort that I was doing everything I could do for my child. And I feel like, I'm sure that there's lots of parents that would prefer to be ignorant of this information or would like somebody else to provide it, but at least if there's any other parent out there who just feels like knowing information would make them feel better, then I feel like if we can help those people, we should. We're sitting on top of a data model, we have standard analytics, and we generate evidence that can actually make a difference in the lives of these patients and their families, and we just need to get on with doing this. So there's me and Catherine. That's Catherine's first git commit to the OHDSI repo. So if you see a bug in feature extraction somewhere in the SQL, you can blame her right there. What I learned watching Catherine grow up is like during that first month felt like forever. That first month in the NICU just felt like, time was stood still and I just was in the zombie zone. And yet, now we're 3.5 years later, and I don't actually think that tragically about those times. Catherine's doing well and she's growing up, but watching her grow up has presented a completely different perspective of what growing up actually means and all the different challenges that we learn as we grow and evolve. And so those issues that I was worried about, like is she going to make it to next week, those aren't the issues that I think about now. I think about a totally different set of challenges. When at first it was just trying to kind of keep her going, and then it was how do we get her to walk to school and go into her little daycare and actually learn some things? And how do we get her to go from walking to be able to talk? And there's Catherine working on the Bradford Hill criteria. And you can see she's standing on my data visualization books and she's trying to figure out coherence. That was always confusing to me too, so I'm going to give her a pass for that. But different challenges happen when people are growing up. At about this age was when Catherine started to actually demonstrate to me that she had logic. If you ask Catherine what's Daddy's favorite saying, she'll tell you that it's sharing is caring. I was always just trying to instill that in her, that sharing is caring, and of course that's a deep spirit to what we were doing here in the OHDSI community. And one day I got home and it was a long day, and I went to like a convenience store and I got a Snicker bar just to have a little sugar before going back downstairs to work, probably on OMOP CDM version 6 or something. And Catherine saw me with this candy bar, and she said, she said, can I have some of that candy? I was like, Catherine, you're too young, you can't have candy. And she looked at me and she said, but Daddy, you say sharing is caring. You care about me, don't you? She got a candy bar. So different problems. Now I'm actually worried about issues about teaching logic and actually about thinking about maturing and making sure that she's going in the right direction. And it's not just about growing up bigger and stronger or better. It's actually thinking about how do I actually set the right course for her in the appropriate direction. So that leads us to OMOP CDM version 6, very naturally. Because last year we released OMOP Common Data Model version 6, and we were actually pretty proud of this release because we expanded the data model even further to handle more use cases. We took more input from the community and got lots of different ideas that came together to create this data model. We figured out ways to standardize data in an appropriate way, and we thought about how this was all going to fit together. So I think it's worthwhile for us to celebrate the OMOP Common Data Model version 6. Elise, could I have another cake? All right. That is OMOP CDM version 6. What you're going to notice about is a little bit less lame, because now we've got our OHDSI blue and orange colors. But most importantly, this was the first cake built by the community, or first data model, I should say, built by the community for the community. And this was the one we all agreed together was going to be the way that we were going to work as a community. We did that last year. Now I got icing all over my suit, and because it's a community effort, this one's a marble cake. We are not just doing safety or just doing comparative effectiveness or anything else. We're actually a mixture of trying to use our data for all purposes that we have, and we need to figure out if this is a community cake where we're doing everything together, we need to figure out how to do all of this stuff together as one community. So Christian's going to eat some cake. The good news for Christian is he actually knows how many common data models we have. So here's the thing. This was the data model that we created as a community together because we thought this was the right thing to advance science. Show of hands, how many of you have an OMOP CDM version 6 instance fully completed? I want everybody to look around. I'll ask the question again in case it wasn't clear. How many of you have an OMOP CDM version 6 instance fully completed? This data model that we all agreed to was the shared community standard that we agreed to and released last year. How many of you have it done? Nobody. Right? Nobody has the OMOP CDM version 6. Why? Well, there's lots of reasons, lots of excuses. I'm at fault for actually a bunch of them. But in part, it was because what we've got is we've got a community that's on a journey at different stages along the way. And when we established the OMOP CDM version 6, what we realized is what we need is to have a data model that works, in conjunction with analysis that works, in conjunction with a community that's actually behind this thing to make it the future and make it what we need it to be for everybody. And when we released the OMOP CDM version 6, I would submit that we had some people in the community somewhat enthusiastic about this development. We had some people in the community thinking that they just needed to change the model. It needed to grow to be bigger and have more tables and have more fields. But what we didn't have was a collective community awareness of what it was going to take to make this the standard that everybody in the community actually is going to need. And what's actually happened over the last year, which I think is really interesting, and I really appreciate the work that Andrew and Claire showcased with data quality, is that having a data model that grows to have more tables and more features, that doesn't actually solve any problems. You know, having a data model that just changes all the time, actually, if anything, it might introduce some problems. Instead, what we need to be thinking about a community is how do we actually mature and grow up the model that we have to not just be a data standard, but to actually be a community effort where we can agree what's important to all of us and how do we make all of our community offerings across open community standards and open source software and open science that we're trying to do together, how do we make this all work together? And that's why I think it's super important that if we talk about data quality, we need to think about data quality as being integral into our OMOP Common Data Model. Adding more tables and fields just for the sake of avoiding the scare of losing data doesn't help anybody. And if we're going to develop analysis tools, we need to make a community decision about if I'm going to build a tool for active surveillance for drug safety, where are we going to store that? What model are we going to use? Are we a community that tries to build software for a whole bunch of different models? That will not sustain itself. Are we a community that's going to constantly just kind of innovate these models and hope that somebody at some point establishes it? Or are we going to do is, as a community, we're going to come together and say, what is the core of the data we need to answer questions for patients? And for that core, what are we going to do to make sure that all of us are following the same rules, the same conventions, the same vocabulary standards, the same approaches to make sure that we have high quality data with consistent analytics that are going to produce reliable evidence? And actually, I think we are at a dangerous point right now in the community where if we don't decide that this is something we're going to do together, we run the risk of actually losing on the opportunity that we're on right now to actually make this evidence high quality and reliable. It's why one of the things that I want to see us do as a community moving forward here is not just have a CDM working group who's focused on figuring out what's wrong with the model and how can we grow it, but instead for us to have a community effort where we're saying, what's right about this model and how can we improve it to improve the collective evidence that we're generating as a community? I'd like to be able to celebrate OMOP CDM version 6 and have every one of you raising your hand, because George showed us that we have a data network across the OHDSI community that has 135 distinct databases in 18 different countries, covering over 300 million patients across outside of the US and most of the US population. We have the world's largest data network, and that means nothing if we can't come together as a community to agree on standards, agree on analytics, and agree that doing open science and generating evidence for patients is the thing that we're going to be focused on. So, dear Theodosia, in that song they said, if we lay a strong enough foundation, we'll pass it on to you, we'll give the world to you. And Christian uses this slide in all of his CDM tutorials about the fact that the data problem we have is one of the problem of electricity around the world having different standards. And once we have a standard that we can all agree to, we can actually accomplish things tremendously. And that's why on your way out, you're going to receive an OHDSI travel adapter that's going to take electricity from any form to any form. We made sure it supports our colleagues in Korea, and our colleagues in Australia, and our colleagues in Japan, and our colleagues in China, our colleagues in Europe. And I tested it last night. It even works in Bethesda. So when you're leaving, please take that as a token of thank you from us. But what I want you to think about is we're laying a foundation, not just for ourselves, but for everybody else. And I take it very seriously that we're on this journey together as a community, and that the power of the community, what you saw from Danny presenting about how a group of people got together and did something in a week that couldn't have been done in a year, how Ishmael is transforming colorectal cancer, how the women of OHDSI decided on doing a prediction study a couple months ago and just delivered high-quality results that could positively impact women with women that are worried about breast cancer. These are the kinds of accomplishments that we can achieve as a community. But we've got to come together as a community to establish standards that we can agree and support not just data standards, but standardized analytics and the spirit of open science that Martijn so eloquently presented earlier today. So with that, I will say that I'm doing this for very selfish reasons, because I don't want to have to go through again what I went through. Catherine is doing well, but I realize that we're one of the lucky ones. But everyone in this room has the opportunity to actually have a tremendous impact. And as you can see from Catherine's Woo t-shirt there, she's all in on this too. So with that, I will stop and say thank you for being here as part of the community. All right, now I'm not done yet. Don't put down my slides, not yet. But I am going to get off the soapbox because now it's one more round of celebration that I get to facilitate as your MC. This is now time for the Titan Awards. The Titan Awards, as you may all remember, is a community-based set of awards that people in the community nominate other people in the community for their extraordinary contributions to the community. And so it's my distinct honor just to MC this. What we decided was last year's Titan recipients, Titan Award winners, are going to be the individuals who actually award this year's award winners. So for the Titan Award in Data Standards, to recognize extraordinary contributions by an individual, organization, or team in the development or evaluation of community data standards, including the OMOP Common Data Model Standardized Vocabularies, last year's winners were the OMOP vocabulary team. So if you guys want to come up, and hopefully Craig is ready for pictures. Where do we want to do this? I want to make sure you get good pictures here. Should we do it over here? Okay, so we're going to do it down there. So you guys go down there, and you can give this to our next award winner. The 2019 Titan Award for Data Standards goes to the Oncology Work Group, Rima, Michael, and Robert. So if you guys could come up. It's going to be a totally serious picture with a bunch of cake behind you. Someone's got to award the. You got to like have a. You got to do like a sharks and jet kind of thing. Craig will tell you what to do. This is what I talk about community collaboration and figuring this out. Yes, this is our data standards group, everybody. All right, congratulations. All right, Martine and Mark, get up. You guys. Our 2019 Titan Award for Methodological Research is to recognize extraordinary contributions by an individual, organization, or team in the development or evaluation of analytic methods for clinical characterization, population-level effect estimation, or patient-level prediction. This year's award, it goes to Jenna Reps. Our methods are efficient. This year's Titan Award for Open Source Development is here to recognize extraordinary contributions by an individual in the design, development, testing, and deployment of open source software to enable observational analyses. I ask Chris to come up to provide this award to the 2019 Titan Award winner for Open Source Development, which is Pavel Grafkin. There's Pavel. And I love the fact that Pavel's bio picture has him with a lei on. So it just gives me this visual that even though I know he's like in a basement coding somewhere, it makes me think he's on like a beach having a Mai Tai while he's writing code at all hours of the day. Congratulations, Pavel. All right. Our award for 2019 Titan Award for Clinical Applications is to recognize extraordinary contributions by an individual, organization, or team in generating clinical evidence that improves health by informing better health decisions and better care. And the 2019 Titan Award winner for Clinical Applications goes to the Oxford Studyathon team. Danny Prieto, Ross Williams. Where's Ross? Ross is here. Edward Byrne, who's not here, but is leading the effort. So if you guys could come up, and Chan will recognize you for that. And for everybody who's part of that. Ugh. Where's Ross? And Jamie, Jamie's here. Jamie, where's Jamie? Jamie, you're supposed to be here. So when Danny presented the work, It truly was a team effort, and it was really exciting to have 30 people all working hard on this. Importantly, though, what was tremendously amazing was that there was some real leaders that stood up as part of this effort. You know, Danny stewarded the overall effort, but Ross decided to take the lead on patient-level prediction, and Jamie and Ed took the lead on the population-level estimation. And they're the reasons why, after a week, we had good results, but there was actually follow-through to those results that resulted in presentations at scientific conferences and now 2 papers that are under review. So congratulations, guys. The Titan Award for Community Support is to recognize an individual, team, or organization for their contributions to ensuring the sustainability of the OHDSI community. This one will be Lee Evans from last year, was our community support person. Where's Lee? There's Lee, come on up. And the 2019 Titan Award for Community Support goes to James Wiggins. So for those of you who don't know, we offer a tremendous set of tutorials, and in all of the tutorials you get to actually have hands-on interaction with all of the OHDSI tools, with data that's available to make all of this possible. And that doesn't just happen by accident, that actually happens by the hard work of a large number of people. But James came to the community and said, you know what, I feel like we could actually help the community get better at being able to implement the OHDSI stack. And he actually stood something up that not only is a great individual solution, but he's actually graciously been volunteering his time and effort to make our tutorials available around the world. So thank you, James. Our Titan Award for Community Collaboration is to recognize an individual for their collaborative spirit in helping their fellow community members reach their goals. Last year's winners, Kristen and Mui, are here to celebrate 2019's Titan Award winner, Andrew Williams. Andrew is showing a very surprised face, but he shouldn't. If there is somebody in the community this year that anytime anyone asked for anybody to volunteer for anything, it was always Andrew who was raising his hand first. He hosted a set of tutorials in the Boston area to evangelize the community more. And as you can see, he's shepherding us through a lot of work in data quality. So congratulations, Andrew. And last but not least, I want to celebrate our Titan Award for Community Leadership. Last year award winner Ray Park will come up. And this is to recognize an individual for their collaborative spirit in helping their fellow community, or not. It's for the best leader in the community this year. And our Titan Award for Community Leadership this year is Peter Reinbeck. All right. So with that, I want to just make a few thank yous. I want to thank our sponsors again for making it possible for us to host this amazing event, to have all of you be able to come together. Thank those who contributed individually and as organizations. Thank the FDA for their generous support through this grant. It's amazing. You know, I remember the first time that George and I talked about doing this, is, so let's just try to hold a free event. And I don't remember who the individual was, but someone says, you can't do that. And sure enough, it's super hard. It takes a lot of work by a lot of people, and then we need to recognize all of their hard work. But it also happens because we have a community together that's willing to share to make it possible for us to pull this off. So thank our sponsors for that. Beyond money, it actually takes a village of people to actually pull off an event that's like this, and this is actually the OHDSI Symposium Organizing Committee, and all of these individuals, I'd like to ask for you to stand up and be recognized for pulling off this amazing event. I want to particularly give a shout out to Elise for putting up with my craziness every year and escorting cakes to the table. And a specific shout out for Maura for being our project manager and our leader through this community to make it possible for us to actually be a community. So thank you, Maura. All right. And with that, I want to thank you all for joining the journey. We are going to start our networking reception. And in addition to what, beverages that you can consume, I'd recommend you all have a couple pieces of cake. I got enough cake for everybody, so please come help yourself to taste any of your favorite common data models, whatever flavor that might be. I look forward to seeing many of you at the tutorials tomorrow, and to celebrate a great day during the networking reception right now. Thank you all very much.
I recommend cake CDM4, by the way.